Hi everyone, Dr. Kalaiko here, and today I want to talk about the effectiveness rates of different COVID-19 vaccines that are becoming available in several different regions throughout the world. So today I'm going to focus on Pfizer, Moderna, Janssen, and Oxford AstraZeneca because these are the ones I get the most questions on. And so one thing that's important to realize when these effectiveness rates are being reported is that the rates that are reported from the clinical trials are averages for the people who were included in the clinical trials. So let's take the Moderna vaccine effectiveness rate, for example. It's been shown to be 94% effective against symptomatic COVID-19 disease. Now, some people in that trial had lower effectiveness than 94%, and some people in that trial had higher effectiveness than 94%. So that number is an average over everybody that was included in that trial. So, and the most commonly reported number that we see out there is effectiveness against symptomatic COVID-19 disease. So basically anybody getting sick with COVID symptoms. One other thing that's important to look at is how effective are the vaccines at preventing hospitalizations and deaths from COVID-19. And it turns out that all four of these, so Pfizer, Moderna, Janssen, and Oxford AstraZeneca, all four of these options are more than 80% effective at preventing hospitalizations and death from COVID-19. So that number or that endpoint is really probably what most of us want to avoid, is that severe disease that would end up, make us end up in the hospital or dead. So one other thing we need to look at in the terms of the trials, or how these vaccines were studied. So how many people were included in the trial? Was it a big number? In all four of these cases, it was tens of thousands of people. So that is a big number. Demographics, so age, race, ethnicity, sex, or gender, and medical conditions. So is this trial reflective of you and your community? So that's one thing to look at. So each of these vaccines were studied in different countries, different regions throughout the world, and at different times. So that's one thing that's important to remember. So the Pfizer and the Moderna vaccines were the very first to get authorized for use. And both of these have shown very similar effectiveness and very similar safety profiles to each other. They were released before the new variants of the SARS-CoV-2 virus emerged in places like South Africa and Brazil and the United Kingdom. And so we don't yet know exactly how effective the Pfizer and Moderna vaccines are against these newer variants. That is being studied right now, so we should know more information soon. We know that Moderna is already working on a booster dose for any variants that it turns out to be less effective against. So this is a common practice in ongoing vaccine development. Remember, with influenza, every year we have to get a new flu vaccine because they need to predict which variants of the influenza virus are going to be circulating for that upcoming year, and they develop the vaccine accordingly to, against the variants that the scientists predict are going to be circulating that upcoming season. So this is not new, having to do this sort of race against the clock and having to develop new vaccine, whether you want to call them booster doses or seasonal doses or what have you. It is really sort of playing catch up with new variants of the virus that emerges. So Oxford and AstraZeneca vaccine. So this one has been shown to have a lower effectiveness against the variant that was identified in South Africa specifically. And so a new formulation is in development, hopefully for release later this year. It's not yet clear whether that one is going to be used as a booster or if it's going to be for first-time patients. Now with the Janssen vaccine, this one was studied in South Africa and Brazil, where a couple of those new variants had emerged. And the good news is it showed effectiveness against them, and it's very effective against hospitalizations and deaths. Also, the Janssen vaccine is a single dose, so that's another kind of advantage of the Janssen one. So the bottom line is all four vaccines, the Janssen, the AstraZeneca, Oxford, Pfizer, and Moderna, are all very effective and very safe options. And there is no preference for one versus the other, with respect to, having to choose one over the other. Really, it's get the first one that is available to you when it is your turn to get vaccinated. That is the most important thing. So no matter which brand of vaccine we get, we still have to continue wearing masks and social distancing in public until we reach herd immunity. So until a significant majority of our population gets vaccinated. So really the most important thing is for everyone out there to get vaccinated with any of the available vaccines that are available to us. And that is really what's going to put us on the pathway towards getting back to some sense of normalcy and getting back to our lives. The good news is that CDC just released new guidance this week that once you are fully vaccinated, so that's 2 weeks after the final dose of whatever vaccine that you get, you can actually be with other fully vaccinated people. So other people who are 2 weeks out from their final dose of their vaccine, you can be with them without masks. So that, gives us some hope that we will get there eventually, as long as everybody does go out and get vaccinated when it is their turn. So hope you found this information helpful, and I will see you next time.